So we're sort of going back to end of 2018, when just around Christmas time, um, we have always had a system in terms of patient appointments where we have a duty doctor. So the patients would ring the surgery, ask for an appointment. A routine appointment is given to them the next available. If it's an appointment, on the day, urgent appointment, then there are urgent appointments reserved on the day, like most practices do, and people are on the line waiting at 8 o'clock to get in the usual problems that patients have. And by about 8:30, 9 o'clock, all appointments are gone. We haven't got any. So this was a story years ago. So we then moved on to a duty doctor system and a telephone triage system where um, patients ringing for a routine appointment, they were given the routine next available without a triage because it's a routine. However, if they wanted an appointment on the day, then their name went onto a list for the duty doctor. The duty doctor would ring and speak to the patient, take a basic history, and then see whether things could be sorted over the phone or whether they actually needed to come in, or whether you could just organize tests, blood tests, x-rays, whatever investigations were required. But then we came to a point where that was just all too much for the duty doctor as well, because if you've got about 50 people asking for an appointment on the day, and the duty doctor has to speak to 50 people, it can be very time consuming and very, very hectic as well. So when eConsult was introduced in Bexley, as Bexley CCG then, and that must have been probably late summer of 2018. Initially, we had not gone live with eConsult, but then we thought, well, if we're going to go live with eConsult, why don't we try it first with the on-the-day appointments? So if you're a patient and you want an appointment on the day, and you ring us, you're asked to complete an eConsult. We're very conscious of the fact that not everyone can complete eConsult. And I think at that point, even the pediatric, all the pediatric templates and things like that were, I think, not live at that point. So really, what we found is that we were able to shift kind of less than half of the patients to eConsult, and still half, or probably so more than half, maybe in the order of 60%, still went up on the list for the GP to ring and do a telephone triage, which took some pressure away, but not all. But we were very conscious of that anyways. And our plan was always to do an initial review at the end of 6 weeks. And we did it right in the middle of winter. So we did it, at the start of December, all of the Christmas period, the most busy time, because it was a kind of a proof of concept. If it works for us, over Christmas, it is going to work for us throughout the year. That was the thinking. And when we did a review at the end of 6 weeks, we said, well, yes, there are a significant number of people who are not able to complete eConsult. Well, if they are not able to complete eConsult, we always had this plan in mind that eConsult does not require any logins and passwords and all that. Why can't we complete eConsult for the patient? So we put a system in place where we had a dedicated administrator who would then ring that patient instead of the duty doctor ring the patient, go through the eConsult with that patient, put the surgery. We created a specific email address, because obviously without an email address, you can't complete it. So we created a special email address, specific one, and that was submitted on behalf of the patient by one of our administrators. And then, 5-10 minutes later, we got the completed product as a PDF into the records. And because it was our email address, so we got a backup. We had a backup copy of that as well. And we want to just make sure that everything is in order in terms of being able to audit things, and from a medical legal perspective as well. And then that was the case for nearly 2.5 years, all the way till the start of COVID. All along, we knew that there were some practices up and down the country who were doing a total triage, and we were always thinking that we must think about going into into sort of kind of the next level, up to the next level. But I think for one reason or the other, there were lots of things going on. We took over a couple of practices. So, one gets really busy when you're going to mergers and things like that. So we just didn't have the time to really take on another project to do a lot of thinking and working, but then COVID comes along, and that was in one way very naturally became a very opportune moment for us to really move to the next level. So that's where we engaged with productive general practice and NHS England, and of course, Mark from eConsult, because obviously Mark has got the most expertise in this. And we worked with PGP and Mark over a period of 2.5 to 3 months, and put our total triage model in place. Of course, when we started off with the total triage model, there was a lot of tweaking that we had to do in terms of processes within the practice. And few things were obvious right at the start, and few things became obvious once we actually went live and started doing things, as it always happens with anything new that you do. And we went live early June, and 3.5 months later, we've done most of the tweaks, and I think we are in a position where we've got things sorted, almost everything. So they were on board. There was a buy-in from them, and it all worked very well. It certainly reduced the workload, because now we have a separate telephone hub. So typically in a doctor's surgery, at the front end, you got the reception desk. The phones are going manic because they're ringing all the time. You got people coming in saying, I've got an appointment. There are people coming in to say, I want to book an appointment. There are people coming to collect prescriptions, blood tests. Now, that's all changed now for two reasons. One is because of COVID, the footfall has reduced because all these things are being done electronically. And all these patients are not coming in because we're probably seeing less than 10% patients face-to-face, and most of it is being done via telephone consultations and video consultations, and of course, online consultations being the most. So I think from a staff perspective, I think it's working very well. From a clinical perspective, the clinicians and the duty doctor is absolutely thrilled, because they only get the eConsults to look at, if you're a duty doctor, if the care navigator, I forgot to mention the care navigator, all the consults are first looked at by a care navigator, who is kind of a traffic policeman, who looks at it, follows the protocol and says, right, this is urgent, this is routine. They are not making a decision whether the patient should be seen or not. They're making a decision what's urgent and what's routine. And once they decide that, the reception teams are ringing the patients to say, come in at so-and-so time, it's urgent, so come in today, or it's routine, you have a 2-day wait, whatever the case might be. And from a clinician's point of view, if I'm the duty doctor, I'm just getting on my list certain e-consults where the care navigator may not be 100% sure. And it's better to, we've said, if you're not 100% sure, you put it on the duty doctor's list, and the duty doctor will suggest to you whether it's an urgent or a routine appointment that's needed. The other really important thing is that where in a routine appointment, a patient comes and sits in front of you, until that point, you don't know what that patient has come to see you for. And sometimes it is quite obvious that they have come for something which could have been done by another healthcare professional. So, doctor, I've come for another prescription of my pill and just needed my blood pressure check. But you think if we knew that in advance, we would have made sure that you saw the nurse instead of the doctor. So you leave the doctor to deal with the more complex cases. With the total triage model, that absolutely gives us the option of looking at the eConsult and clearly filtering out which patients need to see a GP and who need to see a nurse practitioner. So that's really helpful. And of course, when the GP is then doing a telephone consultation, once that patient's name goes on the list, the GP already has sight of what the issue is. So the element of history taking and finding out what the problem was, at the same time, kind of, talking to the patient, trying to put all that in the medical records, typing at the same time, I think all that is massively saved. So we always had that experience when we were doing eConsult for on the day. But now, because we are total triage, literally every call, there is no patient who has any interaction with a doctor or a clinician without either an eConsult or an eConsult Lite. So every patient has got those details, which is usually helpful even for all the doctors. So I think it's a win-win for for everyone, the clinicians and the non-clinicians as well. So I think with regards to the total triage, we kind of had an idea of what we wanted to do. I think the most important thing is that, you know, we could have tried to put everything in place ourselves, but in one way, we knew that there are other practices who have been down this route and put total triage in place. So, why would we want to reinvent the wheel? Why would you not tap into the expertise that's available? And that's where we contacted eConsult, and I can't remember whether it was Murray or whether it was Mark H, but one of them put us in touch with Mark T. And I think having Mark on board was absolutely phenomenal, because everything that we were doing, there was a little bit of, first of all, there was sense check, because yes, Sid, this is a good idea, this works, or actually this won't work. Of course, other than the one bit which we didn't follow his advice, but other than that, we followed all of Mark's advice. And Mark was able to share with us lots of processes, lots of things that have been put in place in other practices who have done this. Mark shared with us the eConsult Lite template, which was great, because again, we were not having to then do a telephone consultation with the patient. We already had eConsult Lite completed by a non-clinician before the GP called the patient. So, and then Mark supported us all through the journey. He was with us on every call with the productive general practice. He shared lots of templates, process maps, a lot of things, everything that the experience that he has from previous projects that he's worked on. So I think it's hugely important, and I think anyone who wants to do total triage must do it only with Mark, not without Mark, to be honest. Mark, don't get a big head, but this is true. It is important. It is important that you take advice and get the guidance from people who've done it before, rather than reinventing the whole thing yourself. It's so important. Three or four very important elements here. One is to be absolutely clear what you want to do and make sure that your clinicians are on board. That's one thing. At the same time, making sure that you do not forget to engage with all your staff and make sure that they understand, because otherwise you won't get the buy-in. And then thirdly, don't rush and do it. Plan it properly. Comms crucial. We had PPG involvement. We had comms all over the place. We had text messages to patients. It was on our website. It was at the front end of our telephone message before the go live date, that from so and so date, this is what the process is going to be. We tweaked the telephone message and made sure that all the details were properly given there. So I think these are some of the things which are really important if you're going to go live and move to a total triage model. The one thing I have to say is that, and I mean, there are other providers who are at the moment talking about their products, and I had the opportunity to look at a couple of them. I think one of the most important things is that what you want when you get an online consultation completed is not just a 5-section consultation which says what's your problem, how long you've had it, and what makes it better, what makes it worse, what do you want us to do for you, thank you. Because that when I could ask those questions when I'm on a telephone call. I think the ability of eConsult to actually, depending on what your problem is, to actually take you down a series of related questions to get all the relevant information, that is so powerful, that's so useful, and anything short of that should not be entertained, in my opinion. So it really works very well, and that's the reason why we are able to sort of consult effectively with our patients, because we have their PDF, we have the details on there, and over the last couple of days, we don't even have to go to Document and have a look, because with the mesh reports and the integration, it's all in the records. And I've already got feedback from my doctors who are doing clinics, Mark, over the last couple of days, that it's so much easier because you're in the notes and it's there. It's not having to go and locate it in document where it is open a separate document and a PDF. So it works very well. So all in all, I think it's a great system, and it really helps our total triage model. Yeah, so I think absolutely, and as I mentioned earlier, that kind of this is always something that we were thinking for a number of months, but COVID really kind of made us do it, because with COVID we had two options. One option would have been to carry on with what we are doing, which is eConsult on the day, and then everybody else who wants a routine appointment, they would just get a telephone appointment booked, and the clinician then rings to speak with them, and then decides then what needs to be done. Now, one of the important things is with eConsult, as I mentioned earlier, we have the entire history in front of us before we ring the patient, which is usually helpful. But the other important thing is that looking at the eConsult, we are even right at the start, we are even able to make a decision whether we really need to bring the patient in for a face-to-face. And there are certain things where you really need to see the patient face-to-face. You're not able to sort it out over the telephone. So I think in terms of COVID, though most practices, well, almost all practices are doing, telephone consultations and virtual consultations. I think eConsult has really helped us kind of take that to the next level, because it's really helped us get everything ready pre the consultation, so that we know we have an opportunity sometimes to look at the patient records. If they are, say, for example, talking about their knee pain, we look at that eConsult. We have an opportunity to spend, a minute or so scanning through the records to see has there been an issue before, so that we are better informed when we ring the patient, and it makes the consultation much more, much more helpful, and I guess we get more out of the consultation. Yeah, so to be honest, we haven't done the financial sort of modeling subsequent to that, because it's just been so busy and so manic. But undoubtedly, even without putting sort of a pen to paper or finger to keyboard in these days, I think it absolutely has to be the case that there is savings, because what we have done is effectively there were clear savings when we were using eConsult for just on-the-day appointments. So that was only a proportion, probably 1/3 of our appointments. If we are doing a total triage model and we are doing it for all our patients, whatever the savings were that we had worked out for 1/3 of our patients, clearly that has to then apply to the remaining 2/3 of patients as well, in terms of time saved, clinical time saved, appropriate clinical time used. So patients seeing a nurse as opposed to a doctor, the time saved, the doctor's time saved, the whole bit about doctors having to ring and speak to patients. Again, if you have the eConsult for all your appointments because you're total triage practice, then you're able to get through that consultation much quicker. So doctors tend to run late, not run late, and finish clinics, more on time. Um, you know, in this time, in COVID time, we're all working under so much pressure. I think the health and well-being of the staff as well is such an important thing. And if you're able to put something in place, and you can't put really a monetary value on that, but just the fact that you have systems in place where you are working in such a way that people feel under less pressure. There's never going to be a time when you're under no pressure, but people feel under less pressure. That itself is hugely important. So I guess there are, definitely, if we were to do some sort of, analysis again, there would definitely be, you know, further savings, and then obviously health and well-being benefits that you can't really put a value on.
So there's a human benefit as well as a financial fact-based benefit as well.
Absolutely, undoubtedly.